Tonight, we're taking a closer look at that telehealth bill. Because of the pandemic, patients can get care virtually, an action that could have ended when the emergency does. But that bill says as long as it's delivered through a HIPAA-compliant platform, health insurance carriers, including Medicaid, must cover telehealth visits. Watching out for your news size Colette Bordelon breaking it down for us.
Even a simple cold can turn into a hospitalization.
For Hunter's mom, Kendra Lubin,
We've already been hospitalized 3 times this year.
Telemedicine was their best bet when COVID-19 hit.
If someone's not feeling well or if he's running a low-grade fever and could potentially have something, we could still possibly do therapy and not spread germs to anybody else.
Her son, like hundreds of other local kids, can get physical, occupational, and speech therapy from MGA Home Care.
It was a little rocky at first.
Therapy director Andrea Skoog is talking about her first telehealth session.
Some of the kids, would be like, why can I not touch you? Why can't I hug you?
But they learned quickly, and some even prefer the virtual experience.
Especially with kiddos on the autism spectrum disorder.
Senate Bill 212, among other things, covers behavioral, mental, and physical health, allows telehealth for everything from a diagnosis to a consultation, and requires a State Department reimbursed health centers for telemedicine services.
We don't have to worry about the child going without and regressing from the progress they've made with our therapist being able to perform the telemedicine.
Even though their client base was cut in half when coronavirus started.
Not only caught back up to where we were pre-COVID, but we also surpassed at this point.
They've gained new clients.
It's actually increased our ability to provide mental health services for our community.
Just like Aspen Point, where 80% of their clients have adjusted to telehealth or telephone services.
Provide more televideo crisis evaluations for somebody who's struggling. And this has been particularly helpful out in our rural counties.
And with this bill being signed, they no longer have to go day by day.
It really allows us to ensure that we're not turning people away because, gosh, your payer doesn't cover telehealth at this time.
Now that telehealth is here to stay.
Colette Bordelon for us tonight. By the way, the bill also lets patients establish care with the doctor through telehealth and does not allow insurance to set limits on the technology needed.